Here to join us for more on this is Dr. Lucky Sekhon. She's a reproductive endocrinologist and fertility specialist at RMA of New York. Dr. Sekhon, thanks for joining us again. Listen, what can actually determine whether a woman is more prone to these perimenopausal symptoms?
Well, it can be very confusing. And first off, I'm so happy that we're covering this as a 42-year-old OBGYN who has recently had the pleasure of experiencing my first hot flash, TMI. I think this is so important because so many people are going through this and it's such a confusing time. And thankfully, we as a society are now starting to talk about menopause. It's not a dirty word anymore. I think it's confusing because when you think about what menopause is, it's much more definitive, right? It's defined as when you stop ovulating, you stop getting menstrual cycles for a full year. And there are actual labs and cutoffs in your lab work that will also rule you in or out for menopause. Perimenopause is a little bit more nebulous. It's a transition phase, and it can last anywhere from 5 to 10 years in the lead up to menopause. And while the average age of menopause in this country is 50 to 51, I treat so many women of varying ages, and we know that everyone's an individual and has their own reproductive timeline. And depending on how many eggs you were born with, your environmental exposures throughout your life, your genetic predispositions, we know that if you've had a mother that went through early menopause, you are many-fold more likely, you're many times more likely to have early menopause yourself. And so because the symptoms can be very non-specific, it may not be something that you realize until you go in and you speak to a doctor. And not all doctors are thinking about this and keeping it at the forefront of their mind.
Yeah, Dr. Sekhon, I'm curious, though, because, with so many women starting families later, right, partnering later, getting pregnant later, does perimenopause prevent women from getting pregnant older?
Well, not really. I mean, perimenopause, by definition, you're still ovulating. So you can be a young person in your 20s, your 30s, even your early 40s, and you still have good eggs. You still have high quality eggs that are in there and can be released from time to time. And if you're still releasing eggs, you're still ovulating and getting periods, even if they're not regular, you still could be technically fertile. And so I have seen young patients that, according to their lab work, they are maybe on the cusp of entering early menopause for whatever reason. And I tell them, listen, if you're not planning to get pregnant and you want to avoid an unplanned pregnancy, you do need to have a plan in the form of contraception, even though a lot of times people assume that if they have a low egg count or they're nearing menopause, that they're not fertile anymore.
That's a really good point, and also a good point to make sure that women should advocate for themselves if they feel like perhaps a doctor is dismissing some of the symptoms that you just described, and understanding that it's sort of individual to each body, but that it can last, as you mentioned, 5 to 10 years. Really important information there. Dr. Lucky Sekhon, thank you so much for joining us.